I'm Michelle Carter, and I'm the owner of MCB Nurse Consultant. And I help directors and nurses in long-term care to overcome their exhaustion and their frustration of being responsible for everything. Before we get started, I want you to like, share, and subscribe to our YouTube channel, MCB Nurse Consultant. Today, I want to talk to all my directors and nurses in long-term care and my clinical nurse leaders about being able to handle staffing challenges. As you know, we are having a workshop on August 20th to the 22nd at 7 p.m., Staffing Strategies Made Easy for Directors and Nurses in Long-Term Care. But today, I want to talk to you about the challenges that comes with staffing. One of the biggest challenges is when we have to be able to have enough staff to cover the units, to take care of the residents, meeting our PPDs, meeting our state requirements, whether state ratios or state PPDs, and also making sure our management team is not covering the carts consistently. All that can be extremely overwhelming. I totally understand. I've been doing this for 17 years as a director of nursing. So I have had multiple times where I ran into those challenges. Some of those challenges can be avoided, and you can do that by learning how to put strong structure and processes in your staffing models. One of the big questions I want to ask you as a director of nursing, who's doing your staffing? Is it your HR? Is it your administrator? And if it is, why isn't it you? Why isn't it the director of nursing or the ADON who are nurses, who understand nursing care, who have the relationship with the team? Why aren't you in charge of your staff or your schedules? Do you have a scheduler? Is it somebody that does it part-time? Is it a person that only does it for a certain amount of days? Or are you trying to put the schedules together every week as it comes? You need more structure. In our workshop, we teach you how to get that structure. But I want to give you some tidbits today. One tidbit is the director of nursing should definitely be involved in the nursing staffing and the nursing schedules. I wholeheartedly believe that it is not the responsibility of the administrator. It's not the responsibility of the HR person. It is the responsibility of the director of nursing. And I'm letting you know that not to give you more work, but to give you a way that you can know what's happening in your building. You know your team better than anybody. You know which team member is going to be good on which unit. You know which team members work together better. You know which teams can handle certain situations and which teams can't. And if you don't know your team, that's another reason for you to come to our workshop so you can learn how to build that connection and engagement with your team by using the bank methodology, which is personality science. A director of nursing should always have a nursing scheduler. Having a nursing scheduler, to me, is one of the most important factors about being a director of nursing. When I say that, not to say, of course, not taking care of the residents, but it is such an important role that a director of nursing needs to have. A director of nursing in a smaller building, even if you're only a 60-bed building, it still has the same regulation as a 300-bed building. You still have to meet a state PPD as a 300-bed building. So you still have, and sometimes when you have those smaller buildings, it's harder because you don't have as many resources. So it's so important that you do have a nursing scheduler and that you have a relationship with them, that you are able to connect with them, that they are able to count on you and you're able to count on them. Another big challenge that we see in long-term care a lot is just getting staff. Just getting staff and getting them to come to work. Let's be transparent. After COVID, a lot of people are not coming into healthcare. And if they are coming into healthcare, they want astronomical rates that maybe our facilities can't meet. And I understand that because we're all in the same boat. So what do you do in those type of situations? One of the things you want to do is the great staff that you have, you want to be able to retain them. And you want to be able to build relationships with them to retain them. You want to know what makes them tick. What's going to keep them in the facilities, even if you can't give them more money. You want to be open to do different type of schedulings. Because be flexible. Talk to your organization about different programs that can kind of oversight some of those scheduling challenges. That's another thing that we're going to be talking about in our workshop this week about how to do special programs. What are some ideas of some special programs? How to retain staff. As a director of nursing, are you interviewing your staff? I've been a director of nursing for 17 years, and I can honestly say in every building that I've worked in, now I have not worked in multiple buildings because I stay at the positions for longer times, but in the buildings and the companies I've worked at, I've always interviewed my own staff. Every CNA, every nurse, every LPN, every RN that comes into my facilities, I have some input in the interview. Now, there are times I can't do the interview, then I have a designated person. But overall, I'm in charge of my interviews because I need to know the type of people that I'm going to be hiring. Once I get that interview, when I can interview you, then I can kind of talk to you about what's going to be a good fit. If I know, for example, that I have a certain position on a dementia unit, and I'm interviewing a nurse that's coming from the ICU, or I'm interviewing a nurse that's coming from the ER, and she's coming long-term care, she might not be ready to slow it down and be on a dementia unit. That might not be a good fit for her. Doesn't mean that I'm not going to hire her, but I know not to put her in that unit. I may be able to utilize her action and blueprint personality in other areas. So you want to be able to, you want to talk to them. You want to talk to them because you just don't want anybody in your building. You want the best people for the best positions. And that's another thing that we're going to teach you how to interview and how to use personality science in your interview so you can get the best person for the best positions. At our workshop, August 20th through the 22nd, from 7 p.m. Eastern time to 8:30, it is a 3-day workshop, and you will also get 4.5 continuing nursing education credits for this workshop. Another challenge that as a director of nursing that we see is having to cover the units and the carts. Believe me, I've been there. And it's going to happen. If you're a director of nursing and you think you're never going to cover a shift or you're never going to cover a medication cart, that is not realistic. It's going to happen. But you need to be able to try and put boundaries and control how often it does happen. You should not be the only person on call. The director of nursing, there are some buildings, directors of nurses not on call at all. And there are some buildings the director of nursing is in a rotation. And I've had both situations. In my last building, my first year, I was on call. And then the second year, I took myself out of the on-call schedule because we had enough managers that I didn't need to be on call. And I did that so if somebody left, I would be the person to jump in to cover so it wouldn't disrupt the other managers' schedules. This particular building I'm in now, the organization I'm now, I have been on call. We have changed how we did on call. When we first started, it was 2 of us. Then it was 3 of us. Now we've gotten up to 6 of us. And we have a smaller building. And I'm going to teach you some strategies on how you can do that in our workshop. But you should not be the only person that's on call. And you need to have boundaries of when you're on call and when you're not. And then you help build your supervisors. If a director of nursing is on a cart 5 days a week and it's covering shifts and doing 20 hours of overtime during the shifts, you are not going to be effective in your role. And your role is to maintain, to direct, maintain, and coordinate the nursing department and enhance quality of care for all your residents. And you're not going to be able to do that because you're going to be burnt out. So you want to find different ways of how you can keep yourself off the cart, how you can get good staff in the building and retain staff, and how you're going to be able to have some structure in your schedules. And you also want to be engaged with your team. If you do not have a relationship with your team, none of this will work. You have to have a relationship with your team. You have to be able to pull on your team when you need them and be there for your team when they need you. Those are some tidbits. I just wanted to give you a little tidbits about some staffing challenges. Again, we are having our workshop August 20th through the 22nd. It is a virtual workshop. It's from 7 p.m. to 8:30. You'll be eligible for 4.5 continuing nursing educated credits. I did this workshop because I know these are challenges that directors of nursing across America are having these problems with. And I want to be able to help you. These are things that I've learned. These are things that other DONs that I've worked with have learned to help put structure into your staffing, into your scheduling, to kind of take some of that weight off of you, that you're able to go home after working 8 hours, that you're able to enjoy your weekend with your family or your friends without having to get multiple calls or worrying about we're short staffed. I just want to be able to share that with you because I've been there. I've been a new director of nursing that didn't understand how to put the strategies for staffing. I've been an experienced director of nursing that went into buildings and the staffing schedules were completely unorganized, where we had to put them back together. So I totally understand that. And I've been in situations when I had to work the card and I had to pick up a shift. I'm an acting director of nursing as we speak. And there's times then it may be my turn, but does it have to be my turn all the time? Does it have to be that me and my managers are always on the card? No. And that's something I want to teach you so you can be more effective, that you can have better outcomes, because when we're able to have good staff in our buildings, quality staff in our buildings, and retain staff that we know that are going to take care of our residents and be able to staff the buildings to meet the requirements, we can be able to give that quality care that our residents deserve. I hope these little tidbits will help you. I want to see you at our workshop. I want you to come join us at our workshop. The link is at the top of the video, where you can come join our workshop on August 20th to the 22nd at 7 p.m. Eastern Time. It's staffing strategies made easy for directors and nurses. We're going to learn so many different strategies on retaining staff, recruitment of staff, how to future-proof your staffing schedules, how to do a master schedule, how to engage your team, understanding the interviewing and the hiring and the interview process from a DON's perspective, and just being able to get things back on track. I can't wait to see you there. Remember, at the end of this video, don't forget to like, subscribe, and share so you can share it with your other nursing associates and nursing directors and nurses so they can learn strategies also. Can't wait to see you on the 20th at our workshop. Talk to you soon.